How do OFA and PennHIP help with puppy selection? Imagine choosing a puppy that will grow into a healthy, active dog 4 years to come. You want to avoid future health issues that could cause pain or mobility problems. That's where OFA and PennHIP come into play. These are two tests that help evaluate a dog's hips, which are often affected by a condition called hip dysplasia. Hip dysplasia is a hereditary problem where the hip joint doesn't form properly, leading to arthritis and difficulty moving. Both tests give important clues about a puppy's future health. OFA stands for the Orthopedic Foundation for Animals. It looks at the shape and structure of the hip joint. Usually, dogs are tested when they are at least 24 months old for a final certification. But breeders can do preliminary tests as early as 4 months. These early exams help identify dogs with good hip structure who are better candidates for breeding or performance work. The OFA grades hips from excellent to dysplastic, which helps breeders choose parent dogs less likely to pass on bad hip traits. PennHIP, which is the Pennsylvania Hip Improvement Program, measures how loose or tight the hip joint is. This test can be done as early as 16 weeks of age. It uses a special X-ray under sedation to see how much the hip can be stretched out of the socket. The test produces a number called a distraction index. A lower distraction index means the hips are tighter and less likely to develop dysplasia. Puppies with lower scores are generally healthier in the hips and less prone to joint problems later on. Together, OFA and PennHIP give a complete picture of a dog's hip health. The OFA focuses on how the hips are shaped and fit together, while PennHIP measures how loose or lax the joint is. Breeders use these results to select dogs with healthier hips for breeding. This helps reduce the chance of passing on hip problems to future puppies. For people bringing a puppy into their home, knowing the OFA and PennHIP status of the parents can help pick a puppy with a lower risk of hip issues. If the parents have good OFA grades and low PennHIP scores, the puppy is more likely to grow into a dog that can run, play, and stay active without pain. From a training point of view, choosing a puppy with healthy hips is a smart move. Puppies with good hip health tend to tolerate exercise better and are less likely to develop mobility problems. Early knowledge of their hip health can help owners and trainers plan activities that support healthy growth. It also means less worry about joint pain during training or play. In short, OFA and PennHIP are tools that give clear, factual information about a puppy's hip health. They help breeders improve the quality of future litters and guide owners in choosing puppies that are more likely to stay active and comfortable for many years. This makes a big difference in how well a puppy can grow, train, and enjoy life.